Support Network's evening group, and thank you for being here. Tonight, we're hosting a panel of 6 people living with IBD who will speak candidly about its impact beyond diagnosis and surgery, how it shapes family life, parenting, relationships,
Right there.
intimacy, and day-to-day experience. They'll share lived experience with Crohn's and colitis, challenge common misconceptions, offer practical insights, and respond to your questions because we'll set aside time for Q&A at the end. So feel free to hold your questions for the panel. With that, I'm pleased to welcome Barbara and Paul.
Hi.
Okay, hi. I'm Barbara Soren.
Paul.
And we've been part of this group for those of you who don't know. I think it's since its inception, Brenda, right?
Yeah.
Since its beginning?
Since the Crohn's group started in 2001 and Pelvic Pouch UC group started in 93, 92.
Right.
A long time.
A very long time. So I'll start by introducing myself, and then Paul will come in, and then we'll introduce one of our sons, David, who has Crohn's as well. Um, so I was first diagnosed with Crohn's it was predicted that I would get Crohn's when I was 21. I had an X-ray done, and the fellow that did it, said that he thought I would have Crohn's, and then that was all I heard for a few years. Um, and then I had a major mass in my gut, and I wound up in hospital for 3 months. And an intern actually noticed that prediction had been made, and he said I had Crohn's definitively. So I was in the hospital for a long time, hoping that they could reduce the mass by putting me on what was called at that time hyperalimentation. I don't know if any of you have been on that. That's like just nutrition. Dr. Gigi Boy used to do that a lot. And we had at that point David, who was 2, and it was a long haul for Paul because he had to manage David on his own for 3 months. Anyway, I ultimately had surgery. I had a resection. The resection wound up being a temporary ileostomy, which was eventually closed. And that was a whole long process. That was my introduction to Crohn's, and it was a harsh one. It was really difficult.
While we were sort of experiencing that, we had just been married, and I had a job opportunity at McMaster in Hamilton in the Department of Psychiatry. The medical school was just beginning. And one of the fantastic parts of being associated with that Department of Psychiatry at the time was there was a strong interest in what was called family therapy. And the chairman of the Department of Psychiatry was an advocate for that. And so and my professional background is social work. So the combination of social work and family, family practice, family practitioners all sort of came together, and it felt like, okay, we're going to have chronic problems with how we're going to cope with the experience of Crohn's disease. But maybe if we cope by including family practitioner, by including just being open to as many opportunities for learning, that maybe we can make this experience manageable for us. And it was, and it is. I mean, we're still breathing and we're still here, so that's good. And this is a long time, eh, Barb? Like 55 years or so.
Yeah, it's been a long time. It's been a long haul. So since then, I had 3 more resections. Every decade, it seems I had another resection for one reason or another. Um, and it's been difficult. It's been tough, and we've coped quite well. I decided when I was in the hospital that aesthetics was my area of interest. I was reading a journal called the Journal of Aesthetic Education, and one of the doctors that came in said, what is that? And I had to explain what aesthetic education was. And as a result, I wound up doing a PhD in the arts and aesthetic education ultimately, and a dissertation that focused on aesthetics. So I think it was the world of aesthetics and museums and the arts, performing arts. I was a dancer originally, that kept me going through all of these years and kept me feeling like, okay, life is possible and doable, and I'll make it all work for me somehow.
One of the things that we decided is that we would have family, we would try to have family, and we were successful. David was born in
73.
73, and our other son, Andrew, in 79. Today, Andrew, our younger son, is living in Halifax as we speak, and we spoke to him earlier today and told him we were going to be on this panel tonight. And I asked him, do you have any nuggets that you want to share with the group? And he said, it just sounds great that you're telling your story. And David has told his story, and that's what we're going to segue to, because when David was 8, he had a fever that we just couldn't figure out how to manage. We consulted with our family practitioner. He knew about Barb's experience with Crohn's. He referred us to pediatric GI. Turns out one X-ray, Barb's looks like David's, and it's like, oh boy, he's got Crohn's disease. So he's now a person with Crohn's disease. Well, he's now, what, 54?
53.
3. And it's taken him a long time to be able to feel comfortable enough to tell his story. When we were in Hamilton, and then I'll shut up on this, I remember asking when he was 8, David, do you think you're going to live in Hamilton for the rest of your life? And in a beat, he said, no. I said, really? Where are you going to live? In a beat, California. Really? And why California? He said, because that's where the cartoonists live. And that moment, and at that point, I was not clear about what I wanted to do when I grew up. So I thought, well, this is fun. But there was light, there was playfulness, there was hope, and it's always been a part of, I think, the way we've tried to cope. We cope with the acute moments and cope with the chronicity that we've had to experience. And then I think my final point is that for all of the time that I was with Barb and David, no one seemed to care about me or Andrew, like no one meaning the health practitioners. And when I retired from social work in 2005, I remember calling Brenda and saying, one of the things that I would like to do in a volunteer role would be to help develop some kind of a support group that would be an opportunity for people who live with people with Crohn's or colitis to have the opportunity to share what their experiences are like. And Brenda linked me with Joanne Solman, and the three of us started a group on the 14th floor. Is that right? That's where it was,
Yep.
right?
Yep.
Yeah. And it was kind of magical. So the Crohn's has given us a chance to manage kind of creatively really hard things. Barb's holding up a book.
So this is a book that David has ultimately written. Took him a long time to be able to talk about Crohn's and about his story, but it's called Invisible: The Story of Me and My Hidden Disease. And it's doing extremely well. So
Middle
he's
grade kids.
middle, yeah. So he's had some really great interviews. One was with Tom Power. We're going to play you 4 minutes, right, Aaron, of that interview, because it's pretty terrific, where he explains why he wrote this book, and it's both written and illustrated.
Yeah.
He's an animator. He's a storyboard
He
director.
did get to California.
He did, and he's been doing animated features for the past over 20 years.
Let's try it. Yeah, really.
So everyone, let me know if you're able to hear this. Okay.
You're listening to Q. I'm Talia Schlanger in for Tom Power. Welcome to the show. The next story is about the things that we struggle with in secret. Maybe you've got something like this, something heavy that you're carrying around with you, but your coworkers, your friends, even maybe your family have no idea. The Canadian artist David Soren knows what that's like. David is an award-winning director and story artist born in Toronto. He's worked on some of the most beloved animated films like Shrek, Chicken Run, the Captain Underpants movie. He's also done voice acting in films like the Boss Baby movie. And he's done all of this while living with a debilitating condition. Growing up, David Soren tried really hard to hide the fact that he has Crohn's disease. And now he's ready to tell his story publicly for the first time. He has a new novel for young readers. It's called Invisible, the sort of true story of me and my hidden disease. And if you've been carrying something in secret, something kind of heavy, there's something in this chat for you. Here's David Soren talking to Tom Power.
Congratulations on the book. Thanks for being here.
Thank you so much for having me. It's a pleasure.
You haven't talked about it. You've actually said you've done everything in your power to hide the fact that you had Crohn's disease. What changed that you wanted to start talking about it?
As a kid, I was the only person I knew with Crohn's disease. My mom has it, and other than her, that was it. There was nobody else I knew. And back then, it was also, people didn't really know what it was. So to tell somebody about it also meant you had to educate them about what it meant.
Yeah.
I wasn't a doctor. I didn't really have the language to describe it, and then when you do get into the symptoms of it, they can be embarrassing.
Yeah, very much so.
And so the combination of all those things was like, I don't want to have to go through the agony of that every time. It's easier to hide it. It's easier just to kind of pass it off like everything's normal.
Obviously something changed because you're speaking publicly about it now.
Yeah, well, I think when I was 8, I discovered that I could draw better than anybody in my class. I was drawing a koala book report about koalas. I finished mine. I looked over at the other kids' stuff around me, and I realized, for starters, mine was the only one that remotely looked like a koala. And then I also realized it was a lot better, and I could draw. And then I started getting praise for it. I had a teacher enter a poster I had designed into a citywide contest. It ended up winning 200 books for our school library. And so by the time I was 8, I discovered this gift. And the same year, I also was diagnosed with Crohn's. I really didn't want to be known for that. I wanted to be known for my talent. Mm-hmm. And that was just kind of how it went. And I was terrified for most of my childhood, adolescence, and early 20s, 30s that the disease was somehow going to derail my dream.
Can you talk more about that? Because you went on to work at pretty early.
Yeah.
And pretty young.
Yeah.
Pretty much right out of school.
It was right out of school, yeah.
At the highest levels of animation, like big projects like Shark Tale and Shrek. So did you feel like the diagnosis, or did you feel like the disease, the Crohn's, was going to hold you back from those dreams? Or?
Yeah, I felt like I was always on the cusp of the rug being pulled out from under me. And that's part of living with this disease. You never quite know when it's going to flare up, when it's going to become a problem, when you're going to kind of hit the end of the road in terms of the medications you're on. And then the last resort is sort of surgery to remedy that. But it's a chronic disease, so that's not a cure. So, I just felt like there was no way, or maybe that there was more likelihood that this disease could truly derail this stuff for me.
I don't want to be insensitive here, but I'm thinking for people who are listening to this.
No,
Thank you both so much.
you're welcome.
Next we have Sue. Sue, I'd love to invite you to share your story next.
Hi, my name's Sue, and I'm on the steering committee as well. I'm going to talk about getting Crohn's as a teenager. Learning that you have Crohn's disease as a teenager can be frightening and overwhelming, which can lead to anxiety and depression. At 15, during my grade 10 year, I was diagnosed with Crohn's disease at Hospital for Sick Kids in Toronto. Like most teens, I wanted to fit in and make friends and feel like I belonged. But I was often in the midst of painful flare-ups. I would run to the washroom and sometimes not make it. Few people understood the severe abdominal pain and weight loss that reduced my weight to 65 pounds. I couldn't manage stairs and needed to use the school elevator, which meant I was often late for class. Because of my illness, I missed school from December 1976 until March 77 and returned just a week before March exams. Unsurprisingly, my grades suffered, and I had to repeat a year of high school, which was humiliating. I took that setback to heart. And after graduating, I took a year off to work before enrolling in early childhood education program. Later, I studied office administration and majored in medical. As my strength returned, I resumed figure skating lessons and eventually coached figure skating for 40 years. Skating restored my strength and gave me my life. It was a long road, especially at a time when there was no support groups and a few people even knew what Crohn's disease was. I fought to reclaim my life, and I still live by the motto, don't let Crohn's control you, you control it. Take it one day at a time, you can do it.
Thank you so much, Sue. That was amazing. Next, I'd like to invite John to speak to surgery and his journey with IBD.
Well, thank you very much. Can you all hear me? Everything's good?
Loud and clear.
Yeah, so my story is of ulcerative colitis, and I would just finished chiropractic college, was a practicing doctor of chiropractic as a resident. 1977, I was working with Dr. David Emery, an occupational medical doctor, and my friend Lou Barbuto, who was in the residency with me, and started bleeding out the back end, thinking it was probably just hemorrhoids. But Dr. Emery said, you know what, this doesn't look right. So I was sent over to see Fred Sable at Sunnybrook, and he said, indeed, this was ulcerative colitis. So the concepts back in 1977, 78 were, you know, Sale Falk and just a minimal type of steroids. They didn't have all the biologics and all the things we have now. So for a year, I coped. I was in Sunnybrook for 3 weeks trying to calm things down. And then in 1979, my good friend Paul Colford, who was a family physician, had a family practice at Scarborough General. He and my wife just said, look, you're not looking well. You're dizzy between your patients. Your hemoglobin's low. Get the heck in. So back I was into Emerge and ended up being in the hospital for 8 weeks. This was July of 1979. So I'm 28 years old. I just finished my residency, looking to help the world, you know, not be a actual quack. I want to be a real doctor, and I'm dying. And I'm lying in bed, the 4th floor in the internal medicine ward, TPN, transperitoneal nutrition. Thinking, there was one moment where I thought, oh, I might not make it. They told my parents I had 50-50 chance to live, but, you know, I'm glad they didn't tell me that because, you know, I'm still here speaking to you, and ended up having surgery. So a subtotal colectomy with a mucous fistula, and a sigmoid to the rectum was kept intact in case we're going to have kids and whatnot, and being able to have that part of it for me. I had an ileostomy for 20 years, continued to cope. I taught for 12 years at the chiropractic college, orthopedics, no diagnosis. We had 2 more kids. I mean, I was very grateful. You know, even though this had happened, modern medicine had helped me surgically, and I continued to live. So I'm meeting with Fred Sable, and I hear about this referral potential to Mount Sinai, and there's Robin McLeod, the preeminent surgeon who unfortunately lost her life last year. She said, you know, this is the gold standard now. We can hook you up. I think you can become continent again. And I thought, whoa, honey, are you kidding me? This is great. So I went back to Fred Sable. Fred said, you know what, you're well adapted osteomate. I don't think you'd really want to do that. Just get closed off, do it. And I thought, well, you haven't had to live with this for 20 years. I'm going to go with the gold standard. I'm going to go with what Robin tells me. And I got rehooked up with the J pouch in 1999 as a 48-year-old. Here I am 26 years later, using the concepts of physical fitness as what I like to keep my weight down, to keep just healthy. And I started to incorporate jogging and then running as part of my routine. So here I am, J pouch, no large bowel, jogging, not worried about losing the bag anymore, in case. And my first 10K race was with the Sporting Life 10K and raising money for Camp Uchiguias. And it was an amazing thing. You're running down Yonge Street from the Sporting Life store down to, the CN Tower, and you're raising money. And I did it, and I got hooked on running. I remember this one lady saying, "Look at you," not me, but just look at you people. You're so fit and healthy. She's screaming away. I thought, yeah, that's what I'm doing. And look what I've been through. Fast forward, raised a lot of money for Team Diabetes at the time. And this group, Syrup, they supported me back then for Team Diabetes. Now it's, Gutsy Walk All the Way. But raised 17,000 for that group and ran my first marathon in Rome, Italy in 2005, and another one in Honolulu. Wanted to qualify for Boston. Finally, as a 59-year-old, qualified for the Boston Marathon. That was my 15th marathon. I remember this group when I met, they're all cheering away. I'm thinking, yeah, like we did it, thank you. And it's the support of this group that really pulled it together for me. And this is why I continue to come back for 26 years to support and talk to anybody who wishes to hear my incredible success story. I mean, some people feel like an outlier because I haven't had the disease. It was cut out of me. And I've done all these incredible things that I might not have even done if I hadn't have had the surgery and pushed to be something more than I actually thought I could be. So it's a real great story. I'm still in practice, seeing 100 patient visits a week. I'm just a young whippersnapper of 75. I mean, life is good. Life is good. So I don't know if the Q&A after, is that good enough? Did I inspire enough people to say stop talking? Yes.
That was excellent, John. Thank you. And I just want to say that when I'm working with people at Mount Sinai who are newly diagnosed, who are contemplating surgery, one of the concerns I hear come up a lot is like, can I keep doing sports? Am I going to be able to be athletic? Like that's a major fear I find people have. So one of the first people that comes to mind is you and always your story. And I love to share that with people to kind of alleviate some of those worries that people have about the future. So thank you for sharing. I do see that we just had a comment in the chat from Catherine that I just wanted to read, just saying thank you to the Sorens family for sharing. I agree, Paul, need to support family. My son was diagnosed in grade 8. It's the same as cardiac. My husband had a heart attack at 46, kids 8 and 11. Younger son developed Crohn's a couple of years later, no support for family, most diseases. Thank you so much for sharing that, Catherine. It's true. There's just such a lack of support, so many different ways for families to cope and learn when a family member is diagnosed.
Could I just add one more thing?
Please.
I just want to thank my wife, Marjorie, for being there through the whole time. I mean, yeah, you need that too. And I had it in spades. There you go. She can't hear me, by the way.
We won't tell her, but it's so true. That's so invaluable. Last, I'd like to invite Kevin and Wendy to share their journey.
Everyone, as you probably guessed, I'm Kevin.
I'm Wendy.
My journey kind of started about 33 years ago. I started feeling sick and kind of passing blood. So family doctor sent me to a GI and he said, "Oh yeah, you got ulcerative colitis," and put me on a few drugs. And a couple of weeks later, I ended up down in the emerge at Mount Sinai and came out 6 weeks later with a temporary ostomy and no idea at all that I could ever live without. We kind of looked and said, "Can you live without a large intestine? What's going on?" Like
our learning curve was steep.
This was all new to us. So, I was very sick for quite a while and didn't respond to any of the drug therapies. And the surgeons came in and told me what they were going to do, and I made them leave. I said, no, I'm not interested in that. Thank you. But anyway, I did go away with a temporary ostomy and a subtotal colectomy. came back 6 months later, had a pelvic pouch, and that worked for about 6 months. And then I started having trouble with that. So I ended up back on drugs, codeine, just to keep from pooping my pants, immunosuppressants, steroids, the whole route. Finally, I guess 10 years later, I had the pelvic pouch for 10 years. They found some precancerous cell activity in the little puff that was left. Well,
But
but
your parents.
yeah, both my parents had colon cancer. So, as John had referenced, our great ally, Dr. Robin McLeod, said, okay, let's get this pouch out and give you a permanent ostomy. And by this point, I knew her quite well. So I said, well, what are the chances if I don't do this? And Robin looks at me and says, are you stupid? Both your parents had colon cancer. So we scheduled the surgery. I went in, I had the pelvic pouch taken out. I have a permanent ileostomy. My bum's sewn up. I think they call it a Ken butt when your bum is sewn up. And that's 20 years. It's been a great life. We both ski, we bike, we hike, we snowshoe, we live a very active life. And I think part of me, I mean, I'm a person that'll talk about it to anybody that'll listen. While even when I was very sick in the hospital, I just kind of, I mean, I'm happily married to Wendy for probably 20 years at that point. I was going back to my job. It was just one of these things. Okay, I'm sick. I'm going to get better. I'll get out of here and move on with life. And we've kind of done that. But I think, and part of that's probably the mental coping mechanism with being very sick, of just kind of going, oh yeah, whatever, I'll get through this. But in the background was Wendy and the family, and it was probably tougher on Wendy than it was on me.
And at one point, I actually forbade Kevin from talking to doctors while he was in the hospital unless I was there. So it was before the era of cell phones used extensively, but it was just like, because I'd come down and he'd say, well, they said this. Well, okay, I'm a more analytic person. And it was like, well, what does that mean? Well, what happens next? Well, what are the next steps? I don't know. Okay, you can't talk to anybody anymore. So we decided some ground rules that worked well for us. And once we established those, it was really good. I mean, it was hard. It was like Paul says, there's not a lot. And everybody's, how's Kevin? How's Kevin? I'm okay too. What about me? But it was, you're trying to do the job, your work job, you're going down to the hospital, you're going down sometimes twice a day, you're coming back. And it was draining, but we were both, when one was up, the other was down. When the other was up, the other was down. So we were really a good counterbalance, probably just knowing each other well.
And I'll just interject too. I mean, out of the 6 weeks I was in the hospital, I think Wendy missed 1 or 2 days because she was out of town. However, I mean, that was her going to work, her office job, coming down sometimes twice a day. When she did visit, she'd be lucky to get home from Mount Sinai to Pickering at 10 or 10:30 at night. And then the phone calls, the this, the that. I mean, it was a,
yeah. There was the SARS in
Yeah.
Oh yeah, another time.
When he was in the hospital during SARS, and it was just like, oh my God, okay. But all of that said, yes, we had about 10 sick years, much like John, with more ulcerative colitis. There was a window of maybe it's Crohn's, maybe it's ulcerative colitis, but he hasn't been sick in the last 20 years. And we ski, we've traveled since we've retired now.
Skied the world.
Yeah, yeah, not really, but we're on our way to do it. So we have goals. We still have lots of life left in us, and we're ready to take it on.
Great.
Thank you both so much.
Thank you.
That was incredible. Always so amazing to hear all of your stories, and I just want to express so much gratitude to all of the panelists and a round of applause. I'd also now love to open the floor up to our audience for any questions that you may have. Feel free to raise your hand or just unmute yourself, or if you want to put it in the chat, I can read them out loud as well.
If I may, I'd like to say something. This is my first time here, and I'm so glad I came. I'm near tears hearing the stories. I was only diagnosed about 5.5 years ago. I was 70 years old. I was diagnosed on a Friday, and on Saturday I had a stroke. And when I hear your stories of recovering, it's really so positive for me. But for me, I was just recently, I was doing well with the Crohn's for all these years until a few months ago when I got very sick and I was on infusions and they stopped working. And then I ended up at Mount Sinai. I also have an ileostomy, and it's just been really a couple of months that I've had it. So this is so new to me. So hearing you speak is just powerful. It's just very powerful because I'm still learning the language. And like you, I think Paul, I'm also a retired social worker. And here I'm faced with something, I guess part of my career was working with people, and I'm in a fuzz. It's a new language. I never worked in this part of the field. And I'm frightened as hell. I'm very lucky because I was matched up with Sue, who's on the panel, and she's been talking to me on the phone. It's been wonderful, but I'm not sure where my journey is going to take me, because I'm also thinking about a reversal because it's physically possible. And then there's concern because of my age. I'm now going to be 77. So, but I don't feel that age. I feel young and powerful. I have many things I want to do. It's just that when I was diagnosed, it was the middle of COVID. So they threw me out of the hospital with because I recovered very quickly with the stroke. And there's always been something external to me that made it very hard to deal with stuff but anyway, it's just, I want to thank you all for sharing your stories, because it's so positive to hear people with smiles on their face when I'm still struggling. So thank you.
You're welcome. That's great. Thank you.
Thank you, Julia, for sharing your story as well. I see.
I hope you all don't mind, because I know it's this question and answer. I don't have a question yet. I don't even think I've been here long enough to have a question yet. I'm still learning, and I'm usually methodical about it, but it's been so crazy. And I was in the hospital for about 8 weeks between the hospital and rehab. So I'm just getting home now, last few weeks.
Glad you're here,
But
Julia.
I'm glad I came.
Yeah.
I'm glad you did too. It's
We are
great.
too.
I'm thankful to Sue for sharing her story with me, and it's been a very positive experience. And maybe I can give back one day.
It's nice to see you, Julia.
Nice to see you too, Sue.
Happy to have you with us, Julia.
Thank you.
I see that Pina has a hand up.
Can you hear me?
Yep, we can hear you.
Okay, wonderful. So I have some questions. My mother-in-law has had part of her large intestine taken out before, and she's got a history of polyps that can turn. Nothing has turned yet to cancer, but the doctor's very concerned. She was just told recently that she needs the colostomy bag and that she should get the surgery and have her intestine completely removed. My question is, if there's no real diagnosis yet for cancer and nothing is bothering her, she has normal bowel movements and she's on her way to 82. We're worried more about the surgery and the recovery then what could happen? What is your advice? That's my first question.
Thank you, Peanut. Do any of the panelists have any feedback for?
Well, this is certainly my connection with Pina. And I said, a gastroenterologist got to see you. You've got to get a diagnosis. Somebody just doesn't tell you to get the large bowel out with a colostomy for nothing. And so seeing the specialist and then seeing the surgeon to see if her mother is the right candidate and the risk reward is there. And it's a decision made by her mom and her and her family. But there's just all those questions, more medical stuff. It's hard to say which way to go. I think the specialist should be there to be able to give the best risk reward answer. That was my
Well
answer.
said, John.
Yeah.
I would have to totally agree. It's really something to be discussed with the medical people and weigh the risks and reward, as you said.
One of my other questions is how long a recovery, like how long in the hospital is typical? And keeping in mind she'll be 82 if she has this surgery.
Brenda, do you want to talk about that? You probably.
Sorry. So most people, if they have any kind of colon resection or ostomy surgery, they're usually in hospital 5 to 8 days in general. But because of her age, if that was surgery was warranted, they would have an internal medicine anesthesia consult too. So they look again at the risk rewards ratio, that sort of thing too. But again, it's all kind of preliminary, right? Because you need to see a specialist, either a gastroenterologist first. I would go with that. Has she had a colonoscopy done?
She has them every 4 months.
All right. Okay.
And the last one, they said they just can't do it anymore. The walls are thinning and it's too dangerous.
Yes. Yeah. Has she ever had an MRI done?
That I don't know. We do have an appointment with the surgeon on February 4th. So that's coming up.
Okay. Okay. Yeah, because that might be worth doing that as well.
Okay. And the last thing, because I was speaking to John about this, and she lives near the Alliston Hospital. That's where her doctor has recommended. And I suggested coming to Toronto to Mount Sinai and getting a referral. She's very worried about upsetting her own doctor. And she wants to know, would they take her at Mount Sinai since she lives in York region?
Of course, doesn't matter.
Yeah, that's what I thought.
We have people from all over the country.
Yeah,
it's always worth a second opinion. And
absolutely.
I guess
and
would
she speak to her GP about getting in?
Yep.
Okay.
Yep.
Okay.
And the one piece that I think everyone on the panel has spoken to is the advocacy piece. You have to advocate for that. There's a whole generation, and I'm part of this generation now too, who don't want to upset anybody, but you're entitled to a second opinion. And they're also, the thing is to see a colorectal surgeon, and they don't necessarily have a colorectal surgeon at the Alliston Hospital. They do in Barrie.
Okay.
But Sunnybrook,
No,
there's a bunch of
it's a
different
general.
places.
She's a general surgeon, and we are a little bit worried about it being there.
Yeah, so I think it's important just to get that second opinion.
Okay, wonderful. Thank you. And to the speakers, you were so inspirational, all of you. I'm 60 and I sit like a lump. I feel like I got to get doing something. So thank you for that.
Thank you, Pina. I saw Megan had their hand up next, and then Rosalind.
Hi. I actually recognize some of you. I came to an in-person meeting once a couple of years ago. I am in my 30s. I have Crohn's disease. I had a resection end of 2024. So it's been a year and a bit. Very challenging, but I think typical presentation of Crohn's. Now I'm had a long time of just being on Pentasa and steroids for many, many, many years. I'm now then got a stricture that which needed to be removed with a bowel resection. Anyways, I don't know why I'm going into all my medical history. It's just I related to a lot of your stories, and it's one of the things I wanted to ask is my partner and I are in the childbearing era, I guess, and it's a concern that I'm in remission, technically in remission, but I still really struggle with doing my full-time job and keeping my energy up and doing a lot better than I have been in the past. But the concept of having children, especially young children, a lot of my friends have young children. It seems very taxing, and I'm just wondering your advice or thoughts. And I know it's always a very personal decision, but I'm always curious to see how those who have the disease manage it, especially in times of difficulty, I guess.
For me, what I'm remembering is, the basic point I'm trying to make is what you're talking about and what I'm thinking about is intimacy. And intimacy at different points in our life has, I think, different meanings. For me, in reflecting back, I mean, you and I, Barb, we wanted to become parents. We knew there was some risk. We were comfortable enough, I think, being uncomfortable and taking the chance. But nobody, I think even to this day, has ever asked me, what has it been like as in your marriage for the way you've managed closeness? Because what you're telling me is your wife had a bag. She was in the hospital for many months for this kind of treatment. She's been taking medications that have these kind of stuff. It's that it made me so frustrated because from my point of view, there was so much going on in me, and there was so much going on that was acute with Barb, and the acute always seems to, and I'm so reluctant to use the word Trump, but I will, trump the chronic part. So when you ask about, when you talk about a relationship, I think thumbs up on that. When you think about having family, I think thumbs up on that. When you think about, is it safe? Well, sometimes you just don't know, right? I mean,
I think what's very important is to consult with several doctors, because when we decided to become pregnant a second time, we had a child, we had Crohn's. We knew much more about Crohn's than we did when I was pregnant with our first child. And when I became pregnant again 6 years later, I knew that I had to ask as many people as I could whether this was a good idea or not. So I had several specialists at that point. I had a GI specialist, I had surgeons, I asked everyone I knew what I should do and what they recommend. And actually everyone said, it's okay, go for it, you'll be okay. And I was okay until I stopped lactating. And at that point, when you lactate, prednisone builds, and when you stop lactating, it drops. And that was when I needed another surgery. So, I mean, it's just really important to find out as much as you can before you go ahead and make a decision.
and the other part of it, though, is even when you do have kids, if you do have kids, when we had kids, somehow or other you manage it all. And you tell, like in our family, telling stories was important, being playful was important, being silly was important, having interests was important, trying to be productive was important. And all of those things normalized what was difficult but not impossible. And at our age now, it's weird when David calls us telling us about this book that he's written. And I'll just go on for 2 seconds, a little bit more than 2 seconds. About 15 years ago, I get diagnosed with tonsillar cancer, stage 4. That's not a good diagnosis. And it certainly doesn't bode well for longevity. Well, I'm here. And what was really interesting is that Barb and David were really helpful for me because they had so much experience with chronic illness through the Crohn's that they went with me to the doctors. I mean, when Wendy was talking, I was sort of just remembering how valuable it was to get the information and to have some consistency about it because it's so much. But anyway, I did thank you, Barb, I think over and over again, but it was very helpful to have their experience inform my recovery.
Megan, I just want to jump in and say that, I agree with what the panel are suggesting and talking to seeing specialists, but we do have Dr. Vivian Wong as our
He's my practitioner. So.
preconception person. So yeah, you're in good hands there. And even you can talk to one of the OB docs about things as well. I mean, that's not a problem to do that. I know also a couple of people that aren't on the panel tonight who aren't available because they're at their children's activities are often my buddies that are happy to talk about why they choose pregnancy or not, that sort of thing too. So I can always link you with them as well.
Thanks everyone. It's such a treat to hear you all speak.
Well, I think it's just important to be thoughtful, Megan. I mean, it's really important to want to have family, and it's important to be thoughtful about how it's going to affect you and your husband.
Yeah.
So I think you can't underestimate what its effects might be, but you can't possibly imagine how wonderful it is to have a child. So, it works both ways.
Thanks, Barbara. And thanks, Megan. Rosalind, I saw that you'd had your hand up first.
Yes, I did. Thank you. And thank you to the panelists. Your words were truly inspirational, as somebody else mentioned, but also gives me hope. I'm in my mid-40s. This is my first time attending because I was just recently discharged from Mount Sinai after 2.5 months of being admitted there, not knowing that when I went for a follow-up appointment at Women's College with my wound care specialist, that an hour after my appointment, I would be admitted to the Emerge, and then 2.5 months later, or 2.5 months, I'd be at Mount Sinai in the isolation room. So my journey, I just have a comment. I don't have a question, but I'm simply at a loss. I've been battling wounds, external, and they've called it subcutaneous Crohn's, which I have to tell you, I had a dozen nurses at Mount Sinai, and none of them had seen the extent of my lesions, both, all in my frontal area, without getting very descriptive, in my back area, all in my lower area. So my Crohn's is very unique in that sense that there isn't a large group of us that have this. In fact, I don't know anybody else that does. I have home care nurses now that also don't know how to treat it. It's very painful. They're all bloody open wounds, and I've had it for over 2.5 to 3 years. Managed myself for 2 years, just using polysporin and Band-Aids, not knowing what it was. I didn't want to go to the Emerge because of COVID, because I'd lost a father in Emerge just 2 years ago. So I have PTSD. I'm traumatized by hospitals in general. This is the first time I've been admitted to an hospital. And so, long story short, I don't want to get into my symptoms because I am very grateful for every day alive. And I know other people's journeys, like the panelists and your families peripherally, have gone through much more extent in your own capacity, in your own ways. But, when I'm told that I'm an anomaly, by 3 different specialists, and I've just been diagnosed a year ago through, the regular colonoscopies and all that. Not only do I have a severely inflamed bowel and small intestines, I also have this external protruding wounds that have deemed me disabled in my mid 40s. I've lost my job. My husband is the only sole caregiver, other than my 82-year-old mom, who's also, not doing the best. So I was also given the diagnosis of you're on your last leg. If you don't head to the Emerge at Mount Sinai in October, that you will not make it tonight. So, when you're told all of this, there's that certain level of fear. You don't have a community or a support system. Nobody around me has ever heard of this. Now I have Crohn's and colitis. And, it's just the story kept worsening week after week. And I would see multiple disciplines throughout the hospital, which I was extremely grateful for. Everybody was doing the MRIs, the CAT scans. I had 2 colonoscopies within the 2 months or the 3 month span that I was there. But everything was just, you're an anomaly. You're a mystery to us. Let's put you on more prednisone. Had the highest doses of prednisone in the last 3 years, which has just, you know, just gone downhill for me. I'm constantly on biologics. I'm on my 4th biologic. My body just keeps fighting and fighting. So, it's not diet. I have dietitians. I'm on TPN. I've been on TPN for half a year. Nothing is working. So when you see that, and, there's that fear of every biologic, every medication that you introduce has side effects and the long-term effects of it, when you read cardiac or lymphoma, that all mentally scares me. But I think I use the most energy in being positive and trying to turn this around. But I have to tell you, it's a hard uphill battle, very challenging when, the stress is on my husband, lost my job, all of this, all because of this debilitating disease. And like I said, I am the anomaly in this whole situation where doctors cannot fix me. And I know this is a chronic problem that cannot be fixed, but I have not in 3 years, my friends, been able to conduct a normal life. I must preface that this is not, I had no predisposition to it. It's not in my family. We don't know where it stemmed from. I do have a family, so my children have been affected by this, and I have not been able to share time with them. I have not been able to be mobile with them. So it is really disheartening. I do keep positive. I follow up. I do all of my, treatments religiously. I follow up with my doctors. I'm in great hands at Mount Sinai and Women's College and at Toronto General. So I'm very grateful that I was able to be fast tracked in that sense. But I have to tell you, I commend you all for having great hope and being able to pursue your lives. I just wish I had that nugget where I could also do that. But because I have that physical limitation externally, which actually affects me more than my internal is totally through the roof as well. I don't want to dismiss that part of it. But I don't qualify as a candidate for an ostomy because I will be infected if anything goes in that general area. So they have all collectively said that's not an option for me. And surgery, I will end up not doing well, recovering from a surgery. So all of that being said, I just want to say this is my first time because I just did just get discharged at Christmas time. They wanted me home for Christmas because that was my one goal that I had, is that I could do something. I was on TPN though for Christmas dinner, and I didn't mind that at all. I just wanted to be home in familiar territory. So, if there's any hope or if there's anyone that I can lean on in future that might have this similar, I'm probably in the 10 percentile of the whole world that has this subcutaneous Crohn's, in addition to the outrageous one internally. But I do thank everyone that speaks about it publicly, because it gives me hope day by day. So thank you all, and thank you for tonight.
My apologies. Sorry. I just was saying, Rosalind, thank you so much for sharing. And John, did you have your hand up? Was there something that you wanted to share with Rosalind?
I did. I just want to commend Rosalind on
This Apple Watch
actually
app
on
knows you're
this.
getting.
I want to maybe Barb can mute hers just so it doesn't come through. Commend Rosalind for coming on and sharing this journey and this incredible story. It takes a lot of guts, literally, those of us who have left, to be able to do that. And my message to her is I don't have the answer for exactly what's going on, but the energy that Rosalind has through all this, being able to share this was pretty incredible. So with that energy and that drive and that wanting to get better, even though it's frustrating as heck right now, I'm hoping for good things for you.
Thank you so much. That means the world to me.
And Pat, I saw you had your hand up.
It's on mute there.
There you go.
Hi, I'm 74 years old and had Crohn's as a child. I'm in remission at age 74. Isn't that wonderful? I live with an ileostomy that allowed me to travel a lot. I just want to say how thankful I am that Sinai exists. I want to say that I hope we all make efforts to support the foundation at Sinai, not just ourselves, but our friends and our community. I think we need to make sure people realize what Sinai has accomplished and what they're doing for people, because it's quite amazing. Dr. McRae took me immediately, really, for surgery in 2016. I went to ICU. She saved my life, and I will always be devoted to Sinai. And Brenda O'Connor has been an incredible support to me. And I just want people to realize that little things that we do to help the foundation, it all adds up. They have a new Sinai shop, and it's pretty cool. I just ordered some products from there, and I'm going to spread it out around my friends, and I hope that they will understand how important it is to contribute to Sinai for their research and all the different things that they do to help people. I guess that's what I want to say today. And this evening was very, very helpful to me. And I know that there's answers for people. Just hold on, press on, hold on, and it can work out. I guess that's all I want to say. That's all.
Thank you so much, Pat. I actually couldn't have brought us to a close any better. For lovely words to share. And I just want to thank you all again so much, both to the panelists and to the audience for sharing everything you did. It's just such an honor to learn from you all and to be inspired by you all. If you do have any further questions or want to follow up, you're welcome to reach out to Brenda or myself. You can just shoot Brenda an email and she will keep me in the loop as well. I also want to mention that we have a daytime group coming up this Wednesday that will be in our 18th floor auditorium at Mount Sinai at 2 p.m. So if you want to come out for the peer support group, all are welcome, both people living with IBD and family and friends. And it did to Brenda and the steering committee, sorry, did anyone have any final words?
Just thank you, Erin, for moderating. You did a great job pulling this all together.
Thank
I
you.
didn't know how it was going to work, but it actually was very successful. So thank you.
So I will say yes, thank you, Erin,
so
very much. I really appreciate it.
Thank you, Aaron, so much. One thing I'd just like to say, it'll only take me a minute. John had kind of mentioned it, of support can also be in the way of bringing someone to doctor's appointments with you as a patient. We always, both of us, even if it's just a family doctor, we go together. Now we have nothing else to do, but that's besides the point. But having an advocate with you makes such a huge difference, especially when you're sick. when the Crohn's, the ulcerative colitis, you're at your wit's end. You're sitting there going, yeah, 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 another doctor. And other than them mentioning your name, that's about the only thing you walk out remembering. So to have someone there as an advocate makes a huge difference.
That's so true. It really does. That's something I encourage, especially people who have been newly diagnosed, to do all the time. If you're feeling overwhelmed or stressed, just having someone there to like take notes, ask the questions you're hoping to ask, help you stay on track. It just makes such a big difference. Thank you. I realize actually we also have a feedback form. So if anyone would like to share any you know, thoughts for next time, things you'd like to see in our evening groups, we have an online survey. Just give me one moment. I'm so sorry I didn't see it in the slides, but I'll just put it in the chat actually.
Just to add to Kevin's being an advocate, I always had a book and I would write down everything that they said. And if they went too quickly, I'd just say, sorry, could you repeat that again? Sorry, could I have your name again? Like I was just very, well, that's me. I'm just methodical, but that's my type. But it was very important. We went back and referenced it often.
It's empowering.
Especially in the beginning years when we didn't have a lot of information on it. We went back and referenced a lot of things that we had written down in the little book.
I always take notes, Wendy. I absolutely always have a notebook and a pen, and I'm always making sure that I keep track of what's being said and how it's being reported.
One doctor called me Judge Judy one time.
For me, when I was in the hospital, what happened?
We can still hear you. We can still hear you. Sorry.
When I was in the hospital, I remember thinking, 7 o'clock in the morning when they were doing rounds and I was opening my eyes up, you didn't have an advocate there. I don't even remember which doctors I saw. And I'd ask for a card. So maybe when I got up, I could write down the names. They don't give cards. And I was very upset about that, actually, because I was trying to be methodical. And I found it, and to understand what was happening. And then I might not see them again till later at night when I was also not in the best place. And whoever I would have had coming to visit me wasn't available any of those times when doctors were sometimes around. And once I'm out of the hospital, not everyone has advocates or people available to them. So I don't know what there is as an answer, but I certainly think the hospital, I remember thinking, give me a card so I know who I'm seeing. I don't need the cards of everybody, when they come with rounds as all the students, but the head doctor, give me a card with your name on it. I could hardly see in the dark your ID card. And then they print the first name very big and the last name in small print. And it's like 7 a.m. And it's just, you're not, at least I was not at my best and most capable of really integrating whatever they were telling me. And I got no notes. I'd say, can you write down what it is I have so I can look it up later when it's not, none of that happened. And I found that very disconcerting for someone who was trying to learn.
Yeah.
That's an excellent point, Julia.
To this day, I write in this book, like my BMs, my urine, blood pressure, stuff like that, what I eat. It helps a lot.
I'm not there yet, but I just, in terms of my hospital experience, everyone was wonderful personally, but the organization of getting people information that is valuable to their recovery and their learning wasn't really available so easily. So the learning is happening now that I'm out of the hospital in many ways. So thank you all, though. Thank you for having this, sharing this experience.
Thank you, Julian. We hope you keep coming back to future sessions. And
I'm looking forward to it.
Amazing. So as you can see here, I put in the chat the link, and then you can also see in the URL, you can just type that in or just click it in the chat box. And you're welcome to just share any suggestions or feedback that you have for tonight's session or for future sessions. All right. Well, thank you so much, everyone, for joining us. No one has any further thoughts or questions. I'll close the meeting soon.
Thank you.
Thank you.
Good night.
Thanks,
Thank you.
everybody.
Good night,
Bye.
everyone.
Thank you.
Bye.
Good
Take
night.
care, guys.
Thank you.
Sent up a little heart.
How do you get out of here?
There
There you go.
or a picture. Enough.
Oh, I'll close the room in a moment, but I just missed this message from Sarah earlier, just as we were ending. She just said, "Hi all, we've missed you. Sarah and Omar here. We missed most of today, kids keeping us busy. We think of this group fondly and are with you in spirit in this IBD journey." Very lovely. All right, have a good night, everyone. Take care.